In a significant public health move, Karnataka Health Minister Dinesh Gundu Rao has announced that all sudden deaths occurring outside hospitals will be officially recorded and notified. Karnataka is the first state to issue such an order. Addressing the media in Bengaluru after receiving the expert panel report on sudden deaths due to cardiac arrest, Dinesh Gundu Rao said that the number of heart attacks in the state have risen by 4 to 5% since the pandemic.
Recent week, we've seen the rising cases of heart attacks in Bengaluru among young people and healthy individuals especially. So to discuss with regards to why this is happening in Karnataka, I'm joined in by the Health Minister, Mr. Dinesh Gundu Rao. Sir, firstly, how concerning is this that a lot of people have died, especially in Hassan region?
No. See, this is not anything particularly concerning Karnataka or any such thing. It is a general issue across the country and all over, where there's a rise in incidence of all these kind of issues like heart attacks, cancers, all that among younger people. And only thing is, our Chief Minister flagged that issue, saying that please look into this because of COVID or COVID vaccination, has it been having any impact on the sudden deaths that have happened, where suddenly people collapse? Is there any link to that? So he had raised that issue in public interest. So we formed a committee to look into these things. So basically the issue is same thing right across the country and even maybe around the world also, where lifestyle issues, and during COVID many people were staying indoors, so the obesity increased, and people got addicted to watching their computers, laptops, and smartphones. So even younger people started using it more. So that, and then general lifestyle issues are there.
That way, if we see then these vaccinations and that idea that was there before, that fear that people had that it's because of vaccine, that is clear that way, because ICMR also has said that nothing to do with vaccine.
Especially the vaccines used in India. There have been some issues regarding the mRNA vaccine, but that is not, we've never used it in India. It's only in some countries in the world, which is, so they had some minor issues concerning that. So nothing to do, link it to vaccines to heart attacks and cancers. There's no such linkage.
Because of a lot of things that have happened in the last 1 week, a lot of panic has been created among people. A lot of people have rushed to Jaideva today. Visuals, if you see, of Jaideva Hospital, it was crowded and people getting their heart checked. What would you tell those people who are watching this? How do they take care of them, even if they don't get a chance to get it?
No, I think there is no need to panic, but generally I think you should take care of your health. And there is all these issues that we have highlighted. These are all also you see in any social media, on television, on newspapers, articles keep coming, but somehow we tend to not take it seriously. So now no need to panic. I think the Hassan issue we'll come to know exactly on we're getting a report on 10th, but I very much doubt it's got any something abnormal happening. It is, I think, let us get the report, then we will inform, but I still feel that no need to get into a panic mode.
I'm joined by Dr. Ashish Sridhar, Lead Interventional Cardiologist, Mangla Heart Center, Hassan. Thank you so much, sir, for joining me. And I'm also joined by Dr. Vanita Arora, Cardiac Electrophysiologist and Interventional Cardiologist. Dr. Sridhar, first to you. Now, this has been made mandatory in entire Karnataka, and the minister has spoken. He said 4 to 5%. Your opening comments, sir.
Yeah, thank you very much. So, since being here in Hassan, what we have seen, at least in the last 4.5 years, is there is a gradual increment in the heart attacks that has been presented at our center. And also, we have also been seeing that there is an reduction in the age group of these who are present with heart attacks. We do see people who are in second and third decade, which was not a norm 4-5 years back, but it has been happening for quite some time. And last 4-5 years, that is the same story. So with all these things happening in Hassan, we were also asked about the data what we had, and we also analyze the data from at least from 2 centers where we do maximum amount of we receive acute heart attack patients and we do primary angioplasties. What we have is the mortality rates in both of our centers range somewhere around 3 to 4%, which is much more, which is acceptable when compared to the larger population. And the data doesn't really show neither an increment in the heart attacks that has been present in the last 2 months, nor the increment in the mortality in the last 2 months. However, having said that, definitely there is a tendency and there has been a inclination towards more and more heart attacks that has been presented to our centers, more and more angioplasties we are doing, and more younger population have been presenting to our center with heart attacks. There is no doubt about it. What we have observed, at least when we analyzed our data, is that most of them who came in the second and third decade, the habits were a real culprit. They either had a genetic predisposition with with a very strong family history, or many of them had a smoking or an alcoholic habit, which really predisposed them to these cardiac ailments. And having said that, it's good that at least now the discussion has started where the youth in their second and third decades, we are talking about them looking into their cardiac health. We are talking about them looking into their get their heart tested. We are talking about people who are looking into the competitive sports to get their heart checked to rule out hypertrophic cardiomyopathy or QT syndromes. And most importantly, about the habits. More and more discussion is about happening about what is the impact of smoking and alcohol on heart attacks and how to prevent it. And of course, the most importantly, at least in a setup like this, in a tier 3 cities or a rural setup where the presentations, the patients with heart attack, they present very late to us. So the golden hour point has been discussed. We have been talking more and more about presentation immediately to the centers where there is primary angioplasty facilities available, and to undergo
Okay.
the emergency angioplasty as early as possible.
Okay. Let me take opening comments from Dr. Vanita Arora. Madam, to you.
Well, what I would want to say is that, linking these deaths to COVID, first of all, doesn't make sense. But incidence of sudden cardiac arrest and incidence of clot formation post COVID has gone up. Now, sudden cardiac arrest and heart attacks are two different things. I don't know what we are missing here, that so many heart attacks, which we are saying are causing death. See, 95% patients, they survive heart attack because heart attack, we know so much about heart attack, and there are so many modalities available for the treatment of heart attack. If a patient is at home, he has chest pain, they know, these drugs should be available, maybe a statin, an aspirin, or a couple of drugs which are available, which should be given to limitize the size of heart attack.